Assalamu alaikum. Let's talk about the third part of vasculitis. Large vessel vasculitis we done. Small vessel vasculitis we also done. Okay, now we talk about the medium-sized vasculitis. The medium-sized vasculitis. What is the type of medium-sized vasculitis? Number one disease. It's a Kawasaki disease. Kawasaki disease is affecting what type of arteries there? Kawasaki disease basically involves the coronary artery system, coronary artery. And this disease is very important. The age group is very important. The age is at less than 4 years or 5 years. The age must be less than 4 years or 5 years. The age of the baby must be less than the 4 year, 5 years. They're having issue with coronary artery. This is one type. The second type, first one Kawasaki. The second one is very famous. It's a very common thing. Polyarteritis nodosa. Why this is very common? Because of hepatitis B. The patient having hepatitis B, the 30% of cases associated with having hepatitis B case, the 30% the chances for development of polyarteritis. The polyarteritis nodosa, also nodule formation there. Polyarteritis nodosa is a polyarteritis. It means the too many arteries there. Polyarteritis nodosa. It can affect the many viscera. It can affect many viscera, many organs. Many visceral vessels affected it now. The patient have the multiple clinical features. The clinical feature related with CNS, the clinical feature related with skin, the person having the muscle pain, the clinical feature related to muscles, the clinical feature related to kidney damage, related to GIT. But not in the only the problem here. It's just the one thing, very big difference from the other small vessel vasculitis. This is the polyarteritis nodosa, the feature because involving many arteries. The other small vessel vasculitis, their clinical feature very much similar to the polyarteritis nodosa. It's much similar to polyarteritis nodosa. One exception here, the polyarteritis nodosa not involve. Polyarteritis nodosa not involve lung vessel. Not involve lung vessels. It not touch the lung vessel, the polyarteritis nodosa. The polyarteritis, 30% is the middle age, the man. Is this the man? How about this age? The age here, the child age. The middle age man, the child age. And the third condition is thromboangiitis. Thromboangiitis. Thrombo is thrombus formation. Thromboangiitis. The thromboangiitis is also known as Buerger disease. Buerger disease. The pronunciation is quite similar to another disease, not mixed with, not confuse this Buerger disease with Berger disease or Berger disease. This Berger disease is a totally different thing. The Berger disease, this disease is the real name for this disease is the Iga Nephropathy. Iga Nephropathy. So this disease is a Berger disease. It's a vasculitis. It's a vasculitis. And how about this? Berger disease is the Iga. It's a nephropathy. It's a nephropathy. It's a disease of the kidney. The related with that this Berger disease may associate with sometime with HSP. Swollen purpura is also due to Iga. The excessive Iga present inside the serum. This Buerger disease, what the presentation, the age is a young patient. It's a young patient. The person a bit young and heavy smoker. That's the key thing here. The person is heavy smoker, and the atypical thing that this vessel, the question here, what vessels we involve? The vessel involved the upper limb vessels and the lower limb vessels. What happened inside the vessel? The smoke is a heavy smoker. It's a heavy smoker. The smoke chemical, a lot of chemical inside the smoke. The small chemical induce here vasculitis. The small chemicals induce vasculitis. And what happened next? The vasculitis, after damage to the vessel, endothelium cell, thrombosis. Yes, thrombosis. So that's why I mentioned your name here, thrombotic angiitis, thromboangiitis. And the person having the strong history, a strong association with heavy smoking or heavy smoker. It's meaning Bourget disease. The Bourget disease is the disease of the vessels of extremities. What happened in extremity? It leads to ischemia if thrombosis there. If ischemia there it the more chances for development of Raynaud phenomena. Raynaud phenomena, and it maybe start the autoamputation. What happened to digits? Autoamputation. These are some typical features related with thrombotic angiitis. It's strongly associated with smoking. Is a heavy smoker. Now we start from Kawasaki disease. What's the Kawasaki disease? We discuss in detail. The Kawasaki disease is also known as mucocutaneous lymph node syndrome. It's a collective disease, affect mucus, affects skin, affects lymph node. It's a summary, and also in plus the having vasculitis, and this vasculitis involve coronary artery. So now it's a full summary. Is a full summary of Kawasaki disease. We try to understand what's a Kawasaki disease, what's happened to the child in the Kawasaki disease. The Kawasaki disease appear in it's a childhood. It's a child age disease, less than 4-year age. The less than 4-year age. What happened with the mucosa? Oral mucosa, and the oral mucosa inflammation there, mucositis. The mucositis is lead to strawberry tongue. It lead to strawberry tongue, one feature. Another feature, cutaneous, the skin, and the skin we're having rashes there, and these rashes, especially rashes present on palm and sole. That together we're having rashes there. Not mixed with infective endocarditis case, having the palm rash. That's have different name, the genuine rash, and that's present on the palm surface, not involve the sole. The palm and sole of the child are having the rash, the redness there. The lymph node, the lymphadenopathy, the which lymph node body have too many lymph nodes, the neck lymph node, the abdominal lymph node, a lot of lymph node there. Having the cervical lymph node. Cervical lymph node enlarged. Okay, in addition to these three findings, we're having a very special feature, typical feature here, the vasculitis. We're learning here vasculitis. So vasculitis, what happened to coronary artery? The heart supplied by two arteries, right coronary artery and the left coronary artery. So when the inflammation starts inside the coronary artery, what happened to coronary artery? Coronary artery inflammation, there may lead to thrombus development, and it may lead to, if inflammation too much, it can cause narrowing of the lumen. Inflammation lead to thrombosis, narrowing of lumen. Inflammation damage the wall, it can lead to aneurysm. It's aneurysm in coronary artery, small level, as a microaneurysm inside the coronary artery. The coronary artery having thrombosis and lead to narrowing of the lumen. It can lead to sometimes happen aneurysm. So all these causes, what they're doing here, it lead to ischemia of the heart. It lead to ischemia of the heart. When it lead to ischemia, this child may have MI. The child may have MI.